traditional Chinese medicine, I understand it's very prevention oriented. Could you talk about prevention versus treatment a bit?
Sure, yes. Traditional Chinese medicine is very much on the prevention side. There's an old saying about the superior doctor having no patients because he's prevented them from getting ill in the first place. It's much easier to keep things going on a proper balance than to wait until they've fallen off and try and bring you back. So that you would get frequent treatments to look at maintaining balance and fix things at the very earliest sign and not wait until the symptoms have gotten poor. So they would educate their patients on proper lifestyle, maintaining their harmony with the environment, eating well, eating properly, exercise, and a proper balance between rest and exercise to keep health instead of trying to wait until it's too late.
And so is that where the concepts of qi and yin and yang and stuff come in, or is that?
Those were more trying to explain what's going on in the body, but exercises such as Tai Chi and Qigong are very much about prevention and maintaining your body's vital energy instead of waiting. So, for a bit of a story, we are given sort of a prenatal energy and postnatal energy. Prenatal energy is what we get from our parents at the time of conception. And if you want to think about it as your inheritance or a savings account, postnatal energy is the energy we derive from the foods we eat and the air we breathe. And that's like your daily checking account. So as long as your life activities are working only off of the daily checking account, you'll have a very long life. The more you dip into that inheritance, the shorter your life ends up, because in terms of life, once our vital energy from the prenatal qi has been used up, that's the end.
It sounds very much like sort of as we understand genetics now, right? Like sometimes you have good genetics and you live, some families live a long time and some don't. It's
right.
Very, an early understanding, I guess, of that effect.
Mm-hmm. And we're finding today that certain things that shorten life are things that draw on that vital energy. So drug use and abuse is going to draw on that energy. Overextending your work, so working too hard, working really, really long hours, never taking holidays, that draws on more than we get from the air we breathe and the food we eat. And so you dip into your savings account in order to maintain that kind of fast and furious lifestyle.
It makes me think of all the talks I've seen in corporate presentations about stress and the load stress puts on the body, and it starts out with minor diseases and moves on to more serious diseases as you steal from that early life force, I guess.
Yes.
Right? I mean, that's tying those two concepts together.
Mm-hmm.